Good evening, everyone, and thank you for coming back again tonight. We are really making a lot of progress in terms of all the conversations we've been having in regard to pregnancy, and we've started into the postpartum period. We talked a little bit about what would happen in the immediate postpartum period for the newborn, but now we're going to move into what happens once we are at home, and we look still at the postpartum period as going up to 6 weeks after the baby's birth. Everybody has heard about that 6 week checkup. So let's talk about what we can expect at home. I want to first talk very much about mom, and I want to say this very clearly and very loudly. Moms need help when they come home with a new baby. No matter how experienced, moms need help, okay? Because their bodies, even though we've had a very, very normal process happen, her body still has to recuperate and heal. A lot is going on for mom and baby and dad as well. We're bringing a brand new little person into the family, and so there are family adjustments that need to be made. This little one is going to want to eat night and day, and that's going to keep mom and dad both up. And as we talked in earlier videos, we have to be watchful for depression for mom and for dad both in the postpartum period. The other thing to know is that let's talk about depression for a second. It's normal to have what we call the postpartum blues, where mom just kind of feels out of sorts. Keep in mind, there is a big adjustment in hormone levels after baby has been born. And so mom can have some periods of just feeling the blues, feeling a little out of sort. But this is not something that should go beyond the 2 week period of time. And in an earlier video, we talked very much about postpartum depression. And that's something that can happen in both mom and dad, likely because of loss of sleep and a lot of changes all happening at one time. But what I want to do is now kind of go through some normal things to expect, and also to call your attention to those things that would require the possible need to call the provider even during that 6 week period. Let's go through. So let's first start from head down. I always like to start from the head and work down. Let's first talk about head. And if there is presence of headaches, spots before the eyes, blurred vision, we've talked about this as signs of preeclampsia during pregnancy. It's very important to know that preeclampsia, even though you may not have experienced it during pregnancy, you can still experience this in the postpartum period. So you do not want to take lightly headaches that don't go away when you're taking some pain medication, spots before the eyes, blurred vision. Yes, I've repeated it. It's really, really important to know. That is something that you should be in touch with a healthcare provider for. A lot of times these things may go unnoticed, and you have to be quite firm in regard to your need to be seen if these things are happening. The other thing, let's move down. Again, we should not be having any sorts of shortness of breath or anything that could indicate a possible blood clot, which would go along with shortness of breath. I'm not talking just your regular shortness of breath. I'm talking shortness of breath that's very different than what you normally experience. That is something that does also require a health provider to be contacted. The other things that we want to go down now is in terms of the breasts. We've talked about with breastfeeding that the milk will come in, as we call it, around day 3, day 4. So you'll experience more fullness in the breasts. If you are breastfeeding, it's something very important to watch for, whether or not you start to experience a lot of pain when the baby is breastfeeding, or if you notice any kind of crackness of the nipples. It's important to get attention for that so that that can help you. Sometimes it depends on how the baby is positioned, that you can change how the baby is positioned to help prevent some of this. Also, with the fullness of breast, the fullness of the breast, sometimes if you go into the shower, a warm shower can help you to express some milk to help get rid of a little bit of the fullness that you may be feeling. Let's go to the abdomen. We talked before about how the uterus, once the baby is born, is going to decrease in size over time. So once you are at home, after you've had the baby, the uterus, the what we call the fundus or the top of the uterus, is usually located at your belly button at the navel. Okay, and each day that should go down one finger breadth. And I talk of finger breadth, the width of my finger. And so each day after you've had your baby, the uterus should descend, go down about the amount of one finger breadth in distance. So once you're at home, you also want to again notice where is the fundus, the top of the uterus. It's something to get the nurses to show you wherever you are, or the midwife to show you where's the uterus so that you know what it feels like. Okay. So once you're at home, you can also feel for that. You can also rub. If you're breastfeeding your baby, you will continue to feel some contractions when you're breastfeeding. And think of this as a good thing, because what it's doing is helping to cause that uterus to contract more and help the uterus to move back down into its place prior to your pregnancy. The uterus will continue to decrease in size and will go down in back into the pelvic area where it normally is. Now, what you don't want to be experiencing with this is if the uterus is not contracting well. We've talked about the discharge called lochia, the discharge that you have. Once that discharge has gone through the cycle, first it's going to be reddish color right after the baby is born, and then it will gradually change over time to a darker red or a pinkish color, and then to a whitish color. Once it has changed to a whitish color, you do not want to see it getting red again. You also do not want to see the amount increasing. So if it has started to decrease greatly in amount, you don't want to see that amount increase again. That's signs that there could be a problem. Other things to notice is you do not want to have any foul odor of the discharge. You don't want to have foul odor at all. Okay? Those are also signs that there could be infection. So if you notice an increase in the amount, if you notice any kind of foul odor, those are things that can indicate possible infection going on. If you have had a cesarean section, you want to make sure that the incision that you have does not have any redness. It does not have any, what shall I say, any discharge, no pustular discharge, none of that. You want to make sure that you keep that area clean. How you do that? Just with your regular shower every day. You can speak with your provider in regard to other needs for care of the incision. But generally, if you're taking a shower, just washing every day, they will let you know when you're able to take a full shower. That's when you would be concerned about the care for the incision. But there should not be redness. There should not be pain. There should not be any kind of discharge or pus coming from that incision. The other thing is that with your legs, you should not have swelling of your feet, hands, or face after you've had your baby. Again, these are signs, once again, of preeclampsia. If you should notice swelling in your feet, hands, face after you go home from having your baby, you need to be in touch with your provider. Now, things to also talk about is contraception. When can you have sex after you've had a baby? Keep in mind that it's going to take your body time to heal. If you've had stitches, I don't think you're wanting to have intercourse at that time because those stitches are needing to heal up. So you need to give yourself time for that. The other is the uterus takes 6 weeks to totally heal. But also keep in mind that it is very possible that if you're not using a contraceptive method, that you can become pregnant before you see your period. All right? I want to reiterate that it is possible to become pregnant before you see the period. Keep in mind, in the menstrual cycle, the ovary releases the egg first before you actually see the period. And if sperm is there, just as prior to having your baby, the sperm can meet the egg, cause pregnancy, and you can become pregnant before you even see the period. Now, for those who are breastfeeding can be a means of contraception, but there are certain guidelines that you must follow. It has to be exclusive breastfeeding. You cannot substitute with water or add water. It has to be exclusive breastfeeding. This is called the lactational amenorrhea method. I have not given you all the information related to that, just to mention to you that if you're breastfeeding, you may want to look into all of the requirements for that to actually be a contraceptive method for you. What I will do is to come back at another time to go through all the different contraceptive methods that are available for you. We do not have enough time in this one video to cover all of that, but I'm just mentioning lactational amenorrhea method as a possible means of contraception for those women who are choosing to breastfeed their babies. So this is the information that I have for you tonight. Oh, I wanted to also say, I forgot to mention in terms of temperature, your vital signs should be normal once you go home unless there are problems. And so we talked about possibility of infection, particularly if we're talking about the discharge having any odor. Same thing if you have cesarean section, if there's any kind of discharge, redness from the incision. You have a temperature. If your temperature goes up to 100.5, that's an indicator, Fahrenheit, that's an indicator of fever. Okay. So this is the information that I have for you tonight in regard to postpartum period, particularly for mom. I will talk next time about the postpartum period for baby and start to move more into contraception. I am going to be coming out with my coaching program. I will have a live webinar starting next week. I plan to have a couple of webinars to provide more information about the coaching program that I'm doing. My goal is to be able to prepare families to understand their health, their family history, their health risks as they go into pregnancy, to help them choose the type of providers that they want to have and the location that they want for their baby's birth, and to be able to help them understand all that's required in terms of informed consent, and to help them have a birth plan, to create a birth plan so that they're able to have the type of birth that they are wanting. My hope is that you can enter the pregnancy in a healthy manner, that you can have a healthy and safe pregnancy and a healthy and safe birth as much as possible. So join me. I will put information in the description for how you can sign up for the free webinar, and I will provide further information for you in the description. Thank you again, as I always say. If you have enjoyed the video that I've provided to you, I'm going to ask you to share this with your mom, your dad, your aunts, uncles, sisters, brothers, cousins, nephews, nieces, friends, everybody. I'm going to ask you also to subscribe. I have had a lot of views. I would love to convert those views into subscribers. So thank you again. I look forward to meeting with you again next week. I hope that you have an incredible week, and blessings. Thank you. Bye-bye.